I am happy to bring to you today some information on the new catchphrase that's going around lately called COVID toes. And I'm going to explain a little bit about why it's occurring and what it is and the types of things that you should keep your eye out for. So first of all, we know the term COVID-19, and we also have heard the term coronavirus. So you may be wondering, what does corona mean? Why is COVID-19 a type of coronavirus? So corona means crown, and there are a group of viruses that are formatted with these spike-like projections that resemble a crown. So any type of virus that has these crown-like projections are called coronaviruses. And COVID-19 is certainly not the first coronavirus. So that takes us to the next question. What is a virus? How is it different than bacteria? So we all know what it means to have an infection. And most of us equate infections with bacteria. It could be a bacterial infection throughout your blood. It could be a bacterial infection as an ingrown toenail. So we're kind of familiar with the term of what bacteria is and what it means. Often for bacterial infections, you're prescribed antibiotics. And an antibiotic is literally something that is antibacterial, and it helps get rid of the bacteria in your system, whether it's local in the foot or throughout the blood supply. A virus is different. It also is an infective agent, but it's a little different in that it works by attaching to host cells, meaning that there has to be something in your body that the virus can enter in order to do its damage. Antibiotics do not help viruses, and we know that because the common cold is not treated with an antibiotic. Sometimes you can get a secondary infection on top of a virus, like a secondary bacterial infection. Many people who have respiratory problems that are from a virus, such as the common cold, will later go on to develop pneumonia, which is generally bacterial. So they are given antibiotics. But antibiotics don't work on viruses as a primary infection. So a few things to keep in mind. Viruses can cause skin eruptions. They can cause rashes. So we often see like chickenpox or hand, foot, mouth disease. We often see the results in the skin that are coming from the virus itself. And certainly a virus that many of us see on a daily basis are warts. And it's funny, when I talk about a wart with my patients, I try to explain to them that warts are a virus like a cold. And it's kind of hard, I think, for people to appreciate that one is a physical thing they can see, and a cold, obviously, you can't physically see. But I talk about improving your nutrition, improving your overall health status, and helping to combat warts in addition to other types of treatments. So I often have, especially kids, I'll often have the kids take vitamins so that it improves their nutritional level when we're treating warts. Okay, so both viruses and bacteria are composed of genetic material. So what is genetic material? Genetic material are responsible for everything in your body. It's responsible for many disease states. It's responsible for the color of your hair, the color of your eyes, the texture of your hair. Sometimes it's responsible even for ingrown toenails. That's fairly debatable, but there seems to be a definite understanding that sometimes it can be considered genetic. So there are two types of material. There is DNA and RNA. So DNA is something that most people have heard of. It's literally responsible for life. And without DNA, a cell can't survive. The DNA is located in the center or the powerhouse of all cells. That's called the nucleus. And just for your information, DNA is double-stranded. RNA, however, is a little different. It can be located in various locations of the cell, not just the nucleus. And it functions to make the DNA work. So if DNA is considered like a flash drive, RNA is what decodes the flash drive and makes it function. And just so you know that bacteria has both DNA and RNA. However, a virus only has DNA or RNA, not both. So how exactly does a virus attack the body and attack the host cells? I said before, a virus has to have a host. A virus cannot live on its own. It has to attach itself to a host cell. So really what happens is it hijacks that cell. It takes over the cell's production of its own genetic input, and it changes the output so that it can function as it wants to function. So it's like a hijack. If you think about your computer getting a virus, it's really the same thing. The quote unquote virus, and this is why it's called a virus on a computer, the virus enters your computer and takes over your computer in some way or form. And it influences the way your computer is functioning. The virus in the body does the same thing. So this is a picture of a COVID-19 virus, and I want you to notice the projections. Again, we talked about the crown-like projections. They're spikes. And these spikes are really what help the virus attach and help the virus transmit its information, transmit its RNA to be able to change the function of the host cell. So the spikes are made of proteins. And when we think of protein, we think of beef or chicken or fish or quinoa, but there's also protein within the cells. So a virus can change the protein. It can affect the protein in the host cell by creating transmission from itself. And in addition to proteins, the other thing we talk about are enzymes. So cells function by proteins and enzymes. And this particular virus attaches to a specific enzyme called the angiotensin converting enzyme. And that is one of the ways that it functions. It attacks any cell that is prone to the ACE2, the angiotensin converting enzyme. And that's how it gains entry into those particular cells. So I thought this was a really good graphic showing the breakdown and the internal structure of the coronavirus. So you can see from the diagram, there are proteins, various proteins that are within, and then what happens is the virus will extend through the extensions to the cells that it's invading. So we talk about the mode of transmission, and keep in mind, I am not an expert on infections. I'm not an infectious disease physician, but I am involved in several groups of physicians that have been talking about the coronavirus and the modes of transmission and the changes they're finding. So on a daily basis, I have been in tune to some of the changes on the theories. So this is what I'm going to say, quote unquote, this is what the medical community knows so far, or at least they believe in so far. Number one, the entry mode is through the nasopharyngeal entry. So that's why keeping your nose covered when you're wearing a mask is so important. You walk around these days and you see people that have their mouths covered, but not their nose covered. So wearing a mask it does two things. One, it stops you from spreading your nasal pharyngeal disbursements, and it helps block those from the air from entering yourself. So keep in mind that the nose is a major area, a major entry point. So you definitely want to start making sure that you are wearing your masks that are covering the nose as well. So we know that it's very contagious. We know that it's very fragile. So that's why washing with soap and water, the fat content of the soap is what seems to break down these types of viruses. So you want to make sure that you're getting in the habit of, when you come home, you wash your hands right away. And even the materials that you're bringing into the house, you want to make sure that you're conscious and conscientious about cleaning and washing and wiping down those materials. There's some controversy of whether or not you need to wipe down your mail or food delivery, but I think it's a good habit to get into, to wipe down anything that comes into your house. The length of survival time is different on different surfaces. And I don't have a slide of that, but that information is out there on if you Google it, you can find it. Although I believe that has changed over time. And keep in mind, as the medical community learns more about the way this virus acts, the information is going to change. And sometimes it changes on a daily basis. But we know it's very contagious and very easily transmitted. So this is, I thought this picture was a really good picture of how the virus might float within the air. There's still debate on how long it may stay suspended in an airspace. I do know of someone who is a runner, and they became positive, and they truly think that this person caught it by running past other runners that may have expelled the virus from their breathing, and it suspended in the air, and it was picked up from this particular runner. So keep in mind that the 6 foot distance it's 6 feet for a reason. At least that's how they feel about it right now, that is the upper limit and how far the particles can actually travel. But there is talk of it, of how long it stays in the air itself, and I don't think they've definitely defined that length of time, but by wearing a mask and protecting yourself, it helps inhibit you absorbing and you inhaling those particles if you happen to be passing the particles in the air. So first, they thought of this condition as a pretty much isolated to a respiratory condition, where it enters the upper respiratory system through the nose, it goes back into the pharynx, and it eventually ends up in the lungs. And the early thought and the early pictures showed very congested lungs, and they felt that it was the congestion in the lungs was caused by pneumonia. And they felt that this was an ammonia type of disease, and that's why people were unable to breathe, and that's why there was so much discussion on the importance of ventilators at the beginning. You may or may not have realized, but the discussion of ventilators has kind of trailed off, and there's also talk that people that have been put on ventilators actually did worse because, but they didn't know why. So what they're finding now, the reasons, is that it's not just an pneumonia type of congestion. What they're finding is that it's actually changes in the arteries and the small arteries that go to the lungs and elsewhere. Those arteries, number one, get inflamed, and the findings they were seeing on x-rays, possibly in addition to pneumonia, a pneumonia type disease, has to do with inflammation of those arteries. And they're seeing that your blood, people's blood is not using the oxygen as effectively as someone who is negative. So you may or may not have heard of people that are having to have a pulse oximeter on, or recommended that they use a pulse oximeter. And the reason for that is to monitor the oxygen in the blood. So there seems to be, the virus seems to affect the body's ability to use the oxygen and to have the oxygen available in your blood, and going to the cells in your body, the various cells in your body, which is all of our, all the cells in the body. The other problem they're finding, in addition to inflammation, is clotting abnormalities. So we're seeing clots. At the very beginning, they were finding that people would do well. They may have been in the hospital, they were let out of the hospital, they were discharged, and they would do well for a certain length of time. And then right around that 10-day mark, they were dying of heart attacks or strokes. And they now feel that there are clotting abnormalities that are going on as well. And as I said, the theories are evolving. And it's really, I think that as unfortunate as it is that this virus is around, I think it's going to teach us more about medicine and more about our bodies. So it's kind of an exciting time from an educational standpoint as we learn more about the virus and how it affects the body and how our bodies respond to it as an invader. Okay, so I thought this was a really good diagram, if you look at the picture in the center, showing how the virus attacks a cell. So if you look, if you can see my pointer, if you look here at this image, here we have the virus itself, and here we have the angiotensin converting enzyme receptor on this particular cell. So what happens is the virus, the crowns or the spikes from the virus attach to that receptor, and that opens up a gateway and allows the virus's RNA to enter the cell. So this is how, if you remember that picture showing the inside of the virus, the little squiggly lines, the single-stranded squiggly line, that is the RNA, the genetic material of the virus. And this is a pretty good diagram showing how it invades the cell itself. So, which cells or which organs have these receptors? There are many organs in our body, and that's why we're finding that so many different organs in the body are affected by this virus. The lungs, the intestines, the brain, blood vessels, heart, kidney, and the blood vessels in our skin. So the theory now is it's not so much a respiratory problem as it is a problem throughout the entire body involving many organs. Okay, so let's talk about why each of you may see signs of the coronavirus or COVID-19. So there are many different categories of people who look at feet other than their own. Podiatrists, pedicurists, nurses, and even parents who are looking at their kids' feet. So I'm going to kind of go off track for a second. It's funny because whenever I have a patient who is a teenage boy and they come in with their parents for a wart, let's say, and the question I ask is, how long has it been there? So the kid looks at the mom and the mom looks at the kid, and they don't know the answer to that question because moms are certainly not looking at teenage boys' feet anymore, and teenage boys are certainly not paying attention to their feet at all. So it's always a question that can't necessarily be answered. So because we're seeing so many signs of COVID-19 in the feet, it is important for parents to start looking at their kids' feet on a regular basis. So there's two general classifications of changes that are going on that will affect the feet that you may see. One has to do with blood clots, whether clotting in the veins or blood clots in the arteries, especially the small arteries that go to the toes. They believe that those are at least one reason why we are seeing changes in the feet. And the other reason is because of the inflammation. I talked before a little bit about inflammation of the lungs and the other tissues that are affected by this virus. So often what happens when you have inflammation of the blood vessels that go to the toes, and each toe has 4 arteries and 4 veins that go to each toe. So what happens is you can get inflammation of those blood vessels, the small blood vessels that go to the toes, and because those vessels are so close to the skin, you can see changes in the skin. So it's both of these reasons why you very well may see signs of the virus. Okay, so COVID toes. I'm sure everyone at this point has heard of the term COVID toes. Number one, I imagine each and every one of you are in tune to anything on the media that is about toes and the feet. And number two, COVID toes has been a very hot topic in the past 2 to 3 weeks, maybe a little longer, because it is a new finding of the COVID-19 virus. So some symptoms, some complaints that patients may talk about, they've talked about it being hot or burning or painful. And those symptoms can be indicative of nerve changes or vascular changes with many different etiologies. So that's not unusual. It may be an early symptom of the virus. It may be the only symptom of the virus. In fact, that's how it first presented with a lot of younger people, kids, teens, and those in their early 20s that were healthy, felt healthy, had no signs of the virus, no respiratory signs, but had these changes in the feet. So that was pretty much how it first came to the attention of the medical community and secondarily the media. One of the things that's going to be really important as we go forward is understanding that these symptoms may and certainly probably represent an active infection. So if you are seeing changes in the toes, you have to assume that the person that has these changes has an active positive infection for COVID-19. So keep that in mind as you start to return to work, depending on where you're at and what state and internationally across the world, that these changes could very well and probably represent an active infection. Active meaning that they are still contagious. And another thing they found with these findings, that with the COVID toes findings, is that they may resolve within the first 10 days of the infection. Okay, so I talked about different causes, possible etiologies. Remember, there are really two categories. Anything that represents inflammation of the arteries, the small vessels, and anything that represents clotting of the small vessels. So there are some other types of problems in the toes that can present from both of these etiologies: frostbite, Raynaud's disease, bruising, inflammation around the skin. Those are all similar types of processes that can cause the same outcome when it comes to what you're seeing in the toe. So now I'm going to go through showing you some pictures so that you can see a variety of different images so that you can keep your eye out for any possible fetal or podiatric manifestations of this virus. And again, often the younger people, they don't have symptoms, other symptoms. It's just the COVID toe sign they're finding. Okay, so these were some of the initial images that were kind of all over the internet and the media when it was first discovered that there were toe changes with COVID-19. So you can see, and I've got some more recent slides, but you can see a variety of situations. There's blistering, there's change in coloring, an increase in pigmentation, whether it is redness or darkness, swelling sometimes, but these are some of the original images that were out there. Okay, so now I'm going to show you some images that I've collected from my colleagues and a couple patients, and some of them are very, very minor or very hard to identify. And if you look at the third toe, you can see some darkness here around the third toe. At the end of the third toe, there's a change. Back here, of course, this area may simply be from irritation from the toenail. So they're very mild symptoms or mild changes. So it may be difficult to identify these changes in some people. Here's another view of that third toe. Here, remember, you've got both the medial and lateral sides of the toe in addition to just the top and the end. There appears to be discoloration here as well on the lateral side of the hallux of the great toe. So here you've got some changes in pigmentations along each of the toes. But this would not be unusual for other conditions. So it's difficult to know if this is COVID, if these represent COVID toes or not. And that's, of course, when history becomes important. Were these present prior to November, December, January, depending on where you're at and where the spread has been in your country? So it's hard to know just by looking at these whether or not they are representative of COVID toes, but getting a history and getting an idea of ruling out other possible etiologies becomes important when we see these patients. This one's a little more obvious. We've got some changes on the fourth toe. You can see here on the fifth toe, and then distally on the other toes. Remember, sometimes you can get blistering and irritation from shoe wear. So if you're part of your history taking, part of our history taking is what type of shoes were you wearing? Were you wearing new shoes? Were you wearing old shoes? Did you go on a longer hike? These days when people are staying inside more, they're not wearing shoes. That's a whole nother topic that I'd love to get into with you all at some point, but it's very common for people to say, nope, have not been wearing shoes. So that would make you a little more suspicious when you see something that may resemble blistering or areas of irritation that you would normally see without the virus. Now this one's a little more obvious. You can see on the second and third toes that those toes are inflamed. They are red, they look painful. There is definitely inflammation going on there. It's also good to note this person has really good hair growth on their toes. So that is a sign that they have good circulation normally. You can look also at the change of the color at the distal tip of the toe. You want to look to see if they're more pigmented, more red, or less pigmented, if they're whiter, or if they're blue, which can indicate congestion of the veins. If the veins aren't working, the blood is staying in the distal part, and it can sometimes look like a blue toe. So here again, you can see here's an area on the fourth toe that could represent a corn. I'm sorry, not a corn, but a hammer toe that could be forming a corn or forming a bursitis there. That's possible. You've also got some discoloration here on the second toe. And over here, this is the area is called the fifth metatarsal head. You can see some hyperpigmentation there on that one. But these are subtle sometimes. Looking at this particular one, again, we've got some hyperpigmentation, and it looks erythematous or red along these areas here. If I were to see this, if I had seen this person as a patient under normal circumstances, I would maybe think there's some fungus going on because of the dryness and the peeling of the toes. Sometimes dryness of the toes and the skin and the feet is representative of fungus, and sometimes it's not. And typically, what I do with my patients, if I'm not sure if something is fungal or not, I will start them on a lotion, either a heavy lotion or like the Poto Expert lotion, or something that I feel is going to really tackle the dryness. And I'll go a week or so to see if there's any changes. And then if there are not changes, then I'll prescribe an antifungal. So sometimes fungus certainly mimics dry skin, and sometimes it's hard to distinguish between the two. So here we've got a blister. So the second toe, you can see all the discoloration and the changes, and the toe is blistered. One of the things that we worry about is that the toes can become necrotic. So certainly if the arteries are affected and if they're inflamed to the point where they're blocked off and blood can't get to the end of the toes, we worry about necrosis and the toes literally dying. This is especially important with diabetics and with those with known arterial disease. So this is a patient from a colleague of mine, and you can, the lighting is bad, I apologize for that, but you can see these darker purplish spots. So sometimes these spots can look more purple and not so much red, and it may represent blood clots to the various areas. But this, certainly this was something new for this particular patient. So here you can see, and again, they can be subtle. So, unless you're really monitoring your feet, you know your feet well, which some of our higher risk patients do. A lot of our diabetic patients do know their feet intimately, so they can identify more areas that are abnormal to their normal day-to-day looking feet. And sometimes it's not mild and it's not subtle. Here we've got ruptured blood vessels. So you're seeing bleeding underneath the skin. And these also can ulcerate. So in addition to gangrenous toes, we worry about ulceration. Here's an example of that. So this one is possibly a blister that opened. It could also be simply an ulceration started from within, from deep within from the vessel and coming externally. This one is also not subtle, and you can definitely tell that there's inflammation going on in these toes. And again, the first question would be, has this person had a problem like this in the past? Here's another example, and it may be isolated just to one area. This particular location is over the interphalangeal joint of the big toe, the hallux, and you may think that it's from irritation from a shoe, because that joint, especially if the toe is not lying straight, that joint often can get bursitis. Of course, if this guy's been wearing sandals for the past 3 months, that would not be the case. Here are a few more examples of the discoloration. You can see this at the dorsal, the top, and throughout each of the toes, and goes back a little more proximally. Even over here at the bunion area, there seems to be some changes too. Again, another example. Looks like we've got some blistering going on in the second toe here, but all these toes are looking inflamed. So the reason I said possible findings of COVID-19 is because these findings can mimic other disease processes. Each of these pictures, while look exactly like the pictures that I just showed, each of these pictures are from patients from previous times. None of these pictures are current. These are all from at least 6 months to a year ago, and they represent different processes. So this one on the left, it's when you have emboli or clotting to each of the toes. This is what it can look like. We saw that in one of the other pictures. You can have blood vessels rupture. You can have inflammation for things like Raynaud's or chilblains or frostbite. There's also something called fasciculitis of the toes that gives inflammation of the toes in different disease processes. And the ones that are inflamed, they're generally from an inflammatory process. So this virus also is a component is an inflammatory process. So that's why they really look the same. There was a study. There have been several studies, but one of the first studies that was really enlightening was done in Spain. And what it found is that they can sort of predict, based on the type of skin findings that they saw, they can sort of predict how severe the infection may be, or what age these particular types of rashes may be associated with. So any type of small, flat, and raised bumps, they found almost half of the cases in the study were of that rash type, and those lasted around 7 days and came out at the same time as other symptoms. And they also found that it tended to be more with severe diseases. And then the middle-aged patients seemed to find blistering types. About a little under 10% of their people found the blistering type of changes in the toes that appeared before other symptoms. So as I said before, sometimes this can be the only symptom, but it's not to mean that it's not contagious. So you definitely want to keep in mind that if you are seeing a patient that has any of these changes, that you are assuming that they have an active infection. So this is another type of finding, and that's one of their classifications, the livedo, the blotchy red or blue. It's sort of like a net-like pattern. And we do see that with many of our older patients, and you all may have seen that too. So they're finding this as well with COVID-19. These are just a few other pictures of different body parts, so you can see different ways in which the virus presents itself in the skin. And these particular patients are all known COVID patients. Many different ways it presents. So the reason I have this slide is I want to show you that the viral rashes from other viruses can be similar. The picture on the right is a kid with hand, foot, and mouth disease, and the image on the left is representative of the chickenpox virus, which also has the spike-like extensions extending from its surface. And just a few comments about other signs that you may be seeing reflective of the times that we're in, with people staying home and people not wearing shoes, and other types of problems that you may start seeing as you start to see patients and you start to see people for pedicures. First of all, viruses can cause different types of problems. So, and it's not necessarily related to the COVID-19 virus, but other types of problems can affect the skin and the skin extensions, such as the nails, in different ways. So you should be cautious and attentive when you're starting to see some changes in the nail plates, for example. This is this is not a patient of mine, but it was someone that I connected with who had surgery. At the time, she was about 6 months post-operative for a bunion surgery, and she had some hardware in there. And she thought she was having a reaction to wheat. So she was going to go see a allergist, but then the breakout started, so I don't know if she's followed up with the allergist or not. But it's definitely an inflammatory reaction. It's definitely some type of the body's, and I'll say autoimmune, but I don't mean it as an autoimmune disease. I mean the body responding to some type of antigen or something that is causing the body to respond. So I'm wondering, is it possible that this person had a reaction with COVID-19? I don't know, but that thought occurred to me. So some other problems that we're going to see as time goes on: if people have not been wearing shoes, you're going to start to see some changes in calluses and skin texture. One of the reasons why people get this pinch callus on the medial or inside of the big toe or the hallux area is because we call those pinch calluses, and they have to do, the reason they develop has to do with the foot not having decent control. Also, the calluses that you see, especially the diffuse calluses you see on the bottom of the foot, also come from lack of control. So as people are not wearing shoes, their feet are not being controlled mechanically and biomechanically. So you're going to start to see some of these calluses become more of a problem than they normally would. And also the heels. When you don't have friction, when you have friction and you don't have control of the heel, often that the lack of control of the heel can also build up calluses. So you're probably going to start seeing more calloused and dry skin problems than you normally would. And I know you've all seen feet like these, heels like these, and obviously we want to keep the dryness under control and avoid the cracking and the fissuring that you see on the picture on the right. So keep in mind, as life returns, when life returns to normal, or wherever you all are, there may be a new wave of infections, so we're going to have to take precautions for a long time. Again, your states and your countries will all determine what are mandated, but keep in mind that this is our new normal. Those of you that take care of pain or take care of patients, whether it's pedicures or other situations where the back of the calf is going to be leaning on something for an extended period of time, we may be seeing blood clots more than we've seen in the past. And certainly bleeding may become a problem. Many people are taking baby aspirin now. Many people are being discharged from the hospital, being put on blood thinners because of the problem. So definitely you have to worry about bleeding more than you may have in the past. But don't worry, summer's coming, so at least we can get outside a little bit. And that's really it. And I invite you all to like and follow my Facebook page. And I've just started putting more information on there, and I hope you all would welcome